In this video, we will explore streptococcal infections. Streptococcus bacteria are commonly found in the human body and can cause a variety of infections. We will discuss classification, clinical presentations, diagnostics, treatments, and complications. Let's start with the taxonomy and classification of Streptococcus. Streptococcus is a group of bacteria with more than 50 species and different serotypes. It is important to recognize and treat infections caused by specific groups like Group A Streptococcus, Group B Streptococcus, and viridans Streptococci. Streptococcal pharyngitis, or strep throat, is caused by Group A Streptococcus. Symptoms include sore throat, fever, and swollen glands. Diagnosis can be made with rapid tests or throat cultures. Treatment involves antibiotics to prevent complications. Scarlet fever is caused by Group A Streptococcus bacteria and presents with a rash, sore throat, fever, and strawberry tongue. Complications include rheumatic fever and glomerulonephritis. Treatment includes antibiotics to prevent complications. Detailed exploration of pathogenesis, clinical features, and management will be discussed. Impetigo is a common bacterial skin infection, primarily seen in children, characterized by superficial, honey-colored crusts and bullous or non-bullous lesions. The most common pathogens involved in impetigo are Group A Streptococcus and, less commonly, Group C Streptococcus. Effective management involves topical or systemic antibiotics, along with good hygiene practices to prevent further spread of the infection. In this section, we will discuss the etiology, clinical presentation, and appropriate treatment options for impetigo caused by different Streptococcus species. Rheumatic fever is an autoimmune complication that can arise from untreated or inadequately treated Group A Streptococcus, GAS, pharyngitis. It primarily affects the heart, joints, skin, and central nervous system. The diagnosis of rheumatic fever involves the application of Jones criteria, which include various clinical and laboratory parameters. Long-term management focuses on the prevention of recurrent episodes, protection of cardiac valves, and prophylactic antibiotic therapy. We will explore the pathogenesis, diagnostic criteria, and long-term management strategies for rheumatic fever in depth. Acute post-streptococcal glomerulonephritis, APSINE, is an inflammatory kidney disease caused by specific strains of Group A Streptococcus. It presents with symptoms like edema, hematuria, and hypertension. Diagnostic tests aid in confirming the diagnosis, and treatment focuses on managing symptoms and controlling blood pressure. Streptococcal toxic shock syndrome, STSS, is a severe condition caused by Group A Streptococcus, leading to shock, organ failure, and tissue damage. Early recognition and management are vital to improve outcomes, with clinical criteria helping in diagnosis. Treatment includes supportive care, antibiotics, and source control. Preventive strategies, such as wound care and managing skin infections, can reduce the risk of STSS. Necrotizing fasciitis is a severe infection caused by Group A Streptococcus that rapidly destroys soft tissues. Early recognition and intervention are crucial. Treatment involves surgery, antibiotics, and supportive care. Prognosis depends on timely management. Streptococcus pneumoniae, or pneumococcus, is a major human pathogen causing pneumonia, meningitis, and otitis media. It is a leading cause of illness and death globally, especially among children and the elderly. This section will cover its epidemiology, virulence factors, vaccination strategies, and emerging antibiotic resistance. This knowledge will aid healthcare professionals in better managing pneumococcal infections. However, in this video, we will specifically focus on Group B Streptococcus, GBS, infections in the neonatal population. GBS is a bacterial pathogen that can cause severe conditions such as sepsis, pneumonia, and meningitis in newborns. The most common mode of transmission is vertical, from the mother to the baby during childbirth. To effectively combat GBS infections, it is crucial to screen pregnant women for GBS colonization. This allows healthcare providers to identify individuals at risk and implement appropriate preventive and management strategies. One such strategy is the administration of intravenous antibiotics during labor. Additionally, close monitoring of newborns is essential to detect any signs of infection early on. In this video, we will delve into the clinical presentation, diagnostic approaches, prevention strategies, and management options associated with Group B Streptococcus infections in the neonatal population. Streptococcus viridans is a collective term for a group of oral commensal bacteria. While typically harmless, they can become opportunistic pathogens and cause infective endocarditis, particularly in individuals with underlying cardiac abnormalities or prosthetic heart valves. Understanding the risk factors associated with Streptococcus viridans endocarditis, diagnostic approaches, and management strategies is crucial for preventing life-threatening complications. We will explore the role of Streptococcus viridans as opportunistic pathogens and discuss the diagnosis, management, and preventive measures associated with infective endocarditis. Group A Streptococcus, GAS, produces numerous virulence factors, including superantigens, which play a significant role in pathogenesis. These superantigens can induce severe immune responses, leading to toxic shock syndrome and other complications. Understanding the mechanisms of action, clinical manifestations, and long-term effects of GAS superantigens is crucial for managing associated diseases effectively. In this section, we will explore the virulence factors produced by Group A Streptococcus, their role in toxic shock syndrome, and potential long-term effects on the affected individuals. In summary, Streptococcus infections are caused by various species and have different clinical presentations. This script provides details on classification, diagnosis, treatment, and complications of Streptococcus-related infections, helping medical students improve patient outcomes.